Well, good day, everyone. Hey, Pat.
Hey, Mark, how are you?
Good. Welcome to Silo 550,
Yeah,
all
it's
the
great
way
to see
from
you.
Kansas.
Yeah, so many of you are probably wondering about this whole Silo 550 thing and what we're all about. Uh, Mark, you and I share a lot of commonalities. It's just sort of astounding how many things that we have similar in our past. But one of those things is that we were both born in Kansas. In fact, 2 blocks apart.
Amazing.
Yeah, it is amazing. And the more we talk and get to know each other, the more we find.
Yeah.
So the Silo 550 thing comes from part of your background, really, and that's the whole Atlas rocket thing. I'm a little younger than you, just a couple of years, but maybe you remember that Atlas rocket stuff a little better than I do.
Oh, I remember it real well. Going to grade school in the 50s and, with a love for aviation like I did and aerospace. My dad was in the aerospace at Lockheed. In fact,
No
all of
kidding.
our relatives were because Kansas had a big aviation business. You know,
Right.
Stearman, Cessna, all of those companies were heavy. In fact, my dad worked for Stearman when he was drafted in World War II.
No kidding. Is that in Wichita or what part of
He was in
Kansas?
Wichita.
Yeah. So that's Boeing had a plant there, and Lear Jet at Cessna, and gosh, quite a few others, I guess, huh?
Yeah, I never actually, other than the fact that it's flat, so you don't run into too many things. I always kind of figured why Kansas seemed to be the cradle of the American aviation early industry and still is there. But that would be an interesting segment one day, Pat.
Yeah, a lot of wind and very few trees, I guess, probably helped.
Oh, they got some wind. I
They get some
remember
wind.
sitting on my grandfather's porch. I might have been about 8 or 9, watching a tornado tear across the prairie. And we just sat there and watched it like you might watch a rainstorm in Georgia.
I was in a tornado in Topeka in June of 1968. That was a big one and killed a bunch of people. So yeah. Anyway, back to the Silo 550 thing. That's a squadron in central Kansas. And so we're paying a little homage to the double entendre of silo being farming and
Right.
also Atlas ICBM and in Kansas in the central part of the U.S. But what we're trying to do with this podcast, at least this first season, is to focus on AI because, frankly, it's overwhelming. Have you found it that way?
Yeah. Yeah. I've been fascinated. I signed up for Chat GPT the first month. I had one before that didn't really work nearly as well.
Yeah.
But the whole generative AI thing is just a revolution. And there are so many out there now. There's almost an AI for every profession or occupation or reason. I use it many times every day. And of course, we're both from the healthcare world,
Right.
and that's kind of what we're interested in. Is this going to help us? Is this going to help patients? Is this going to help doctors?
Yeah. My background is mostly marketing, although I did some sales as well. And both of us are from orthopedics, but you were primarily in sales and sales management, right?
Right. Yeah.
Yeah. And I think that the application of AI in medicine is really exciting from a product management and marketing standpoint because of the problems it can solve. I go to Vanderbilt. I live in Tennessee now, and I go to Vanderbilt, and they use this ambient listening quite a little bit. And the notes seem to be pretty good, but I think it takes a lot of the doctor's time still to teach it the right things.
It's pretty huge. You and I were part of a company called eTrauma, and we
Yeah.
introduced digital imaging and one of the first orthopedic EMRs, electronic medical records. And we really thought that by taking them digital, we were going to help them a lot. And we accidentally contributed to, on the EMR side at least, a lot of physician burnout and frustration. I've heard it said, and I believe it, that about half of the time of a clinical day is spent on documentation into the EMR and writing orders. It didn't used to be that hard. they weren't spending half of their days flipping through charts.
Yeah, I've listened to some seminars from Oracle. They bought Cerner, and
Right.
they're moving it all to where I live now in Nashville, and they're creating a new AI-based EMR, electronic medical record system, and they one of their main targets is the whole lifestyle of the physicians. They're trying to give them back some of their family time and take away this burden of note taking and updating records in the EMR. So, we're going to take this very first episode and draw upon one of our e-trauma buddies, the guy who really invented remote image and some of the products that we sold. A couple of the products that we sold at e-trauma. Dr. Kishore Tipirneni
Right.
is going to join us today from Phoenix, Arizona. He's a practicing orthopedic surgeon and a heck of a good guy, but he's also a coder, which is an amazing thing to think a guy could have those diverse talents and be so good at both of those things.
I used to call people geeks, and it was kind of an insulting term. Now I just call them millionaires, and I kind of wish I'd been a little bit geekier. He's going to be one of many people trying to help doctors fight their way through the wasted time and effort that they spend in just getting information into their EMR. And a corollary that I take from sales is that I've never been successful in getting a sales force to use a CRM.
Yeah.
And the reason is because it just takes so much time.
And then when they leave, you lose all that knowledge base. It's a nightmare.
Yeah. So maybe some of the things we're learning here, we can kind of put into the CRM side to help them. We'll see. Okay.
Yeah, there's this whole interoperability thing that's being talked about too in medicine, where not only do the electronic medical records capture the information in a fast and succinct way, efficient way, but they also can share the information between systems. So I'm anxious to learn what AI can do in that as well, because the radiology systems don't necessarily talk to the EMRs, and the front desk doesn't necessarily talk to the billing system. So there's a lot to do in medicine to fix this, and we all know they still use fax machines. It's ridiculous.
I know. Yeah. Somebody says use a fax. I just look at them funny, like what? But they're still used. They're still used every day.
Yeah, even at Vanderbilt, when I was at the last appointment, they waited for the lab report to come in via fax while I stood there and waited in the office.
You remember the Indiana Jones movies?
Oh, of course.
Okay. Remember on that first one in which they took the Ark and they put it in for safekeeping, and it turned out to be a giant warehouse full of forgotten, lost relics and treasures. Okay.
Yeah, right.
Around 2000, 2001, when we were introducing digital imaging, I could walk in, and I think I still can. I can walk into any hospital's like computer room, and I'll see stacks, and I can tell by looking at that stack approximately from what year it came and what it does. Like over here is the imaging pack stack.
Yeah.
Okay, and over here would be the operating room record stack. And these computers don't talk to each other.
Right.
Traditionally. Another AI related topic that I want to put into a future episode is the value and the potential monetization of patient data, assuming you can safely anonymize it so that the protected health information doesn't leak out, because that gets you into HIPAA jail pretty quick, Almost every big orthopedic practice that you and I would know has had a cyber attack.
Yeah.
And if you have a really big one, the CEO or administrator is going to lose his job.
For sure. Yeah.
And almost always. And I could give you some examples of that. But let's bring Dr. Kishore Tipirneni onto the stage and get going on this first episode. Thanks, Dr. Tipirneni, for joining us today to to talk about AI and healthcare and practical ways to use it. So, Patrick, why don't you lead us off?
Mark and I have known Kishore for a couple of decades, and he orthopedic surgeon in the Phoenix area. But his abilities in coding and just computers in general, software creation, have been exceptional. So we thought we'd bring Kishore on to help us understand where AI is headed in the medical space. This is changing all of healthcare, right, Kishore?
It is. I think that healthcare is the slowest to adopt technology, right? I mean, let's face it, we're still faxing documents back and forth. So it is changing healthcare. It's on the cusp of changing healthcare, and there's certain things that are being done. I don't think it's gotten to the point where it's gotten mass adoption, though.
How does a healthcare professional use AI in 2025 and not get swept away by the onslaught of new programs and new tools and new ways? It seems like every time you turn around.
I think, like, in general, there's the problem with AI in medicine is a problem of valid data, right? I mean, all these AIs, these large language models or LLMs, you ask it a question, it'll come back with an answer. The answer is never, I don't know. It's always like something. And you don't know if that answer is right or not. I think they're programmed to always give you an answer. So obviously in medicine, you can't ask it a medical question and have that much confidence that what you're getting back is actually valid. And so it's not at the point where, like, I can just say, hey, I got this patient with these symptoms, what do you recommend? It's nowhere near that point. But if you want to use it for reference, like I said, I use it to look up ICD-10 and CPT codes. It's pretty good with doing that. Even those aren't 100% accurate, so you have to kind of check it. But it definitely gives you a good start. Yeah.
Every time I ask ChatGPT or Grok or Claude or any program a question, it always comes back and says, "Mark, that's a brilliant question."
Yeah.
It always starts out with this really positive.
That's
You're
funny.
so smart. It's like it's programmed to butter you up first before it feeds you full of any potential misinformation.
Oh, yeah. It's always like that.
Yeah, that's great.
I mean, so, like, as you guys have said, I'm a coder, so I write code, and it is unbelievably useful for coding. The AI is.
So you use it regularly to code?
Oh, yeah. Oh, my God. Because let me tell you, I started coding back in the 80s, okay?
Yeah.
On an Apple II computer. I taught myself coding from the manual that came
Wow.
with it. And back then, you had books is how you figured out how to code, right? You had to get a book at the library, the bookstore, read it, you write some code. If it doesn't work, it's not like you got to figure out, and it took forever to code something simple, okay? That changed a little bit in the 90s. Coding got a little bit easier because you had the internet, and you can actually go to places like Stack Overflow or whatever, and people ask questions. How do you do this and how do you do that, right?
Right.
Okay, which is still much faster than reading a book and just figuring it out on your own. But the problem with coding as opposed to medicine is coding changes every year. I used to go to the Apple WWDC, the developers conference, every year, because every year they come up with a new version of iOS with all these new features and new code and that you had to learn. So the amount of information you have to learn as a coder is a lot, and it changes every year. That's the problem. In medicine, I've been in practice for 29 years. Not that much has changed in 29 years. I mean, yeah, there's some updated stuff and this and that, but the pace of change is very, very slow. So it's not like you have to do something like that. So now with these LLMs and ChatGPT, I just say, hey, listen, I need you to write me some code in this language that does this, and it just spits it out. Now, like I said, does it know that this is the correct code or not? It really doesn't matter, because you're going to take the code and you're going to paste it in there and you're going to run it and see if it works. Sometimes it's stuff I'm like, I don't even understand this, because it's very complex, some of the stuff you ask it to write.
Yeah.
And then I just plug it in, but I hit run and let it run and said, oh yeah, it works, So that's the amazing thing. So I'm writing an app right now, an iOS app for the company I have, that if I think about it, I started writing this app about a week and a half ago. It's almost done. This same app before ChatGPT would have taken me 2 months.
Crazy.
Yeah.
Wow.
For example, I'm building the iOS app, right, for the project I'm working on. We're going to take that code and we're just going to dump it into probably Claude. Claude is a little bit better at coding than ChatGPT, and say, convert this over to JavaScript or Java
Nice.
for an Android, and it'll just translate it.
In medicine,
Yeah.
how is AI being used today, and where do you see it going over the next 2 or 3 years?
That's a great question. So right now, I mean, I think that any product that's good has to solve a problem. And the one problem that a lot of companies are trying to solve right now is the documentation problem, which is the problem where physicians, especially since EMRs, are spending more time doing documentation, button clicks, and everything else in these EMRs than actually seeing and diagnosing patients. And so that's causing physician burnout on the one side. And it's not what we were trained to do. It's not what we signed up for.
Yeah.
So one of the ways that they're trying to solve that is through AI. The concept is nice, where you just record audio of a patient visit between you and the patient, and then the AI listens to that audio and generates a documentation for you.
So this is the ambient listening. Like when I go to my doctor at Vanderbilt, he says, "Hey, is it okay if I use ambient listening?" That's what he's doing.
Yeah. It's one of those type of products. No, the idea is good. The practicality is not so great, and that's why it hasn't been widely adopted yet. There's a lot of edge case scenarios, I call it, with that thing. A lot of conversation between a physician and patient is not medical.
Yeah.
I was talking to my partner yesterday who was using one of those types of devices, and he's like, this lady, I just asked her, how she hurt her knee, and she goes into this 5-minute story about how she went to the gym, and it's a great gym. Do you go to that gym? And all this stuff. And I met my friend there, and talking to her, and all this stuff. And finally, at the end, then I was on the treadmill, and I slipped and fell and hurt my knee. All that other conversation, the AI has to sit there and listen to and determine if it's important enough to put in the note. So in order to do that, you have to be highly intelligent in order to be able to do that. That's the first issue. And so a lot of these AIs, they give you all this extra information that if you get the note, you have to edit it and take out all the stuff you don't want in there first place, then it's not really saving me much time. Right. The second issue is there's a lot of things that we don't say verbally normally during a clinic visit that goes into the note. A couple of examples: physical exam. I'm saying, hey, does your knee hurt here? Was I'm pushing on it? Well, the AI doesn't know where I'm pushing, right? So in order for me to sit there and get it to understand, I'd say, does your medial joint line hurt? Does your lateral joint line hurt? Oh, it seems like you have a negative Lockman's test for your knee. And all of that is like, for the patient, is like, what are you saying?
Yeah.
And so it's not very comfortable. So a lot of physicians are averse to that. So the physical exam's an issue. The third thing is like procedures. Okay, I'm going to do a knee injection. Well, normally in my note, I put down exactly what I injected, all that kind of stuff, to document all that. Well, how does that? That's not on the audio. So a lot of these ambient AI systems, do a decent job of getting the note, but there has to be so much editing on the back end that sometimes it's not even worth it. So because now you have to read this entire note, and it's like, okay, I have to re-edit this whole thing and add all this stuff.
Yeah.
So that's where it's at. But I'm trying to fix that problem by building a new type of ambient system that uses AI for post-processing to handle all those things.
And that'll be for orthopedics specifically?
It'll be for everything in medicine.
No kidding.
Yeah.
Wow. How are you able to train it to take all this clutter that happens in ambient listening and boil it down to a template that just stamps out?
That's the magic. I'm not going to get into the magic, but but I know those are the problems.
Yeah.
And I know that it needs to be able to put into the note only what's medically relevant. So, but here's the thing about AI. It's a general garbage bag term, right? LLMs are AI. There's other AIs that do things. And that's the difference, is everybody's used to ChatGPT and these type of LLM things. There needs to be specific AIs for specific problems. Like this AI that listens to the audio file and generates this note has nothing to do with ChatGPT. It's a completely different type of model. So you can't use ChatGPT to do something like that. You could try. I'm sure that it will try to do it. If you upload an audio file of that visit, hey, generate an office note from this, I'd be very curious to see what would happen, but I definitely wouldn't trust the output.
Kind of walk us through how yours works or how your vision works.
So because I understand the technology side and the physician side, I understand that workflow is very important. Okay. For me, that's why I was asking you, Pat, like, what's a recording device? Because for me, I record everything on my Apple Watch, right? It's unobtrusive. Wow. It's right there next to me. I'm right in front of the patient. So our app runs, it can run on the iPhone too, but I love using the Apple Watch for it. You just go in there, hit record, and then when you're done, you hit done, and that's it. That's all you need to change. Yep. Yeah. So that's on the front end. The back end, I know that, like, for example, like if I do an injection on the patient, that's not going to be in the note, like the procedure note. Okay. Mm-hmm. On the back end, we're using a second AI to do post-processing on this note. That basically you tell it, hey, when I do an injection, I want you, and if you hear that I do a knee injection, for example, I want you to put into the note automatically for me this text, which is my standard knee injection. And so like that, you can give instructions on the back end to
I see. Second
AI on exactly what you want it to do. It's kind of like talking to a human scribe, where you just tell it, hey, every time I do this, or if I do this, if I say this, put this in, or whatever, and all that kind of stuff. So it's a combination of two separate types of specific AIs, and actually a third one as well, because now that you have the note, how does it get into your EMR, right? Mm-hmm. Because now what are you going to copy and paste it in there? You can, which is fine, but these EMRs have different boxes for different information. They have one box over here for the history, one box for the physical, one box for the assessment and plan, like that. And every EMR is different. So our third AI is a different type of AI than the first two. It's called computer vision. So it can visually see the screen just like a human and knows what the user interface for the EMR looks like, and goes in and does all the button clicks, clicking on this box, pastes the text from the second AI in various different places, and automates that entire thing. So, what I'm building is a combination of 3 different AIs to solve one problem.
Interesting. Do you envision a next step beyond that?
Well, if that solves the problem that we're solving, the problem is the documentation. So beyond that, I mean, if once the AIs get smarter and stuff, you can, that second step where it's got the note now, you can sit there and say stuff like, generate the CPT and ICD-10 codes for this, and it'll do it. Or give me the latest research articles on the whatever the diagnosis is for me.
Wow. So how much time currently does an orthopedic surgeon spend in doing what you're talking about? And what will this boil it down to, do you envision?
So they've done studies on this. So the average physician spends more than 50% of their time in clinic doing documentation.
Wow.
Okay, so an 8-hour day, that's 4 hours. So with like this, there is no documentation. You still have to review the note and say, okay, yeah, whatever the AI came up with is what I want. But that review takes like 10, 15 seconds as opposed to 2 or 3 minutes of dictating a note or whatever you were doing before. Mm-hmm. So, it is like you're going to cut the documentation time down by at least 75% of what you were doing before.
So you eliminated the dictation or the writing or the button clicking.
Yep.
Which means that you probably are reducing the time by what, at least 50%?
At least. I mean, I'm thinking more like 95%. Yeah.
At least.
Yeah.
And I think it reduces fatigue on physicians, and it probably speeds up the whole patient experience. It certainly provides them with better notes than they would have gotten had they relied on just the physician and maybe even the transcription person to accomplish. So I think it probably improves accuracy, don't you think, Kishore?
Yeah, there's no question about it. I mean, I've been alpha testing or beta testing, whatever you want to call it, our new product in our office. And the amount of stuff that goes into the note, how detailed it is now is fantastic. Really. I mean, it's documenting like so much better than I could have ever done. Yeah.
And what do you call the program?
Tempida. Tempida.
PI. Okay.
Yeah.
When do you think it's going to be available potentially? With conservatively speaking,
we're looking to launch it in about a month.
And how will that roll out? Will it be specific to orthopedics at
No.
first, or any
It's going to
specialty?
be a website. You just sign up for free, and you got a 7-minute video that shows you how to use it, and then you're ready to go.
Wow.
And what EMRs will it plug into?
Every EMR.
Every EMR. Wow.
Because remember that third component, the autopilot, we call it the autopilot component, which uses computer vision. We just basically say, okay, this is what this guy's EMR or this gal's EMR looks like. I need you to click on this button, go over here to this box, take this information, paste it in there, and then go to the next thing, whatever. So we just
you map it out.
Yep. And there's no interface to it, right? There's
Right.
no actual interface to the EMR. It's working just like a human that can visually see the screen and does the button clicks just like a human scribe would.
No license required? No, nothing.
Nothing.
Wow.
How quickly does it populate the EMR?
Much faster than a human. Because the human has to move the mouse and then from this button to that button. This thing can go move it instantaneously.
Can the physician visualize that while the patient is still in the room?
You're seeing it working. It's like, who's clicking all these mouses? Who's clicking these buttons and all this stuff? It looks
That's
like somebody, but it's much faster than a human. AI is so fast, it has to wait for the EMR to catch up sometimes.
Right.
You know, Pat, it's going to be kind of like breaking down all those fences across the prairie in Kansas.
I wonder what the people of Bird City would think about this.
It's going to make the ranchers really mad. I guess the ranchers in this case are the EMR companies.
Well, Kishore, thanks a lot for, giving us this overview as to what's happening in things that will impact patients and physicians. And it's always great to talk to you, but this is exciting stuff. I can't wait to see it in action, and I wish you the best in your launch. And we'd like to ask you if you could come back maybe in
we didn't have time, but I have some general ideas about where AI is going outside of medicine and stuff.
Yeah.
And like what the future really this is for humanity. And there are definitely some concerns that I have.
Yeah, that'd be great. We'd love to have you for another episode.
Well, that reminds me. So I would like to do, how's AI going to affect patients and consumers, and general population? If you wanted to learn about AI, what's the best way? All the different courses, the free course. But what may be even more exciting than that is to kind of delve into what you were just talking about. What is AI going to mean for not just medicine, but for kind of, folks.
Humanity. Well, Mark, I write novels, and my fourth novel it's called Red Moon Dot. I don't think you read that one, but it's basically that.
All righty. Well, thanks very much for coming.
Thanks for having me.
Thanks, Kishore. Enjoyed it.
Be well. Take care. Pat, that was fun.
I really I learned a lot there. That was great.
So I think one of the things that I learned from Dr. Tipirneni, who's a practicing surgeon, a physician, is that the amount of time wasted, the frustration, the burnout amongst doctors and using EMRs is real.
Yeah, the true benefits of generational AI come from changing how things get done, right?
Yeah.
And so that's where we're headed.
Finally. That's phenomenal. So, and the work he's doing with his Tempida is designed to help doctors reduce that time, save up to an hour a day easily.
Yeah.
By automatically creating their notes and helping them just bypass a lot of the type. There's no inputting with what he's doing. Nobody has to type on a laptop or, we've all been to the doctors in which the door opens, the doctor comes in, but in front of the doctor or the PA or nurse practitioner they're pushing like this stand with a laptop on it, which is kind of like their little robot. Yeah. And as they're talking to you, they may be looking at you, but they're probably looking at that screen and they're typing it in and so forth. And so, how are you feeling today? You still have that cough? Okay, type. All that's going to be gone.
That's a dream come true, and it can't get here soon enough.
No. So that was a great session. Certainly, I learned a lot, and I think that in our next episode, it'd be kind of fun to look under the hood and see how AI is affecting the people that make digital technology, that create new programs and software, and seeing if it's going to help them, seeing if some of them are going to lose their jobs, or are they just going to have to evolve?
Yeah, AI is so vast that we have to focus somewhere, and I think that the idea of choosing medical profession, I think there's a lot more to learn here.
I want to help just regular people, non-techies, non-geeks like us, see how we can use it in our everyday lives, whether you're in healthcare or not. Maybe like eating an elephant, one bite at a time. How to handle this sort of tsunami of AI that's coming at us from all directions.
Yeah, there's
Kind of
thousands of
staggering.
AI products, and it's coming at us so fast, and so many training courses, and
Yeah,
every university seems to have a training course or an executive course. So it's a bit overwhelming right now.
that would be a great episode.
It would. We should go through what's available and what we might even recommend for others.
How do I learn more about AI if I'm, say, an accountant or a salesperson or an engineer? What are my best options? You're right. That would be a great episode.
Yeah, and we'd like to invite our listeners to suggest topics, and so they can send that to Mark at Silo550.com. What else do we want to?
Okay, I want to invite people to start thinking about AI humor. Okay, if you have an AI joke, send it to Mark at Silo550.com or Pat at Silo550.com. Because I think in the future episodes, when we wrap it up, maybe even at the introduction, we should have an AI joke because there's going to be some funny stuff. Well, let's wrap up today. I wish you a good Kansas weekend.
And you, and to all our listeners, thanks for tuning us in for this very first episode. And we'll bring you more and better as we get accustomed to all this.
There you go.
Where seldom